Welcome and thank you for joining today's Secure Beef Supply Plan webinar. And with that, I'll turn the call over to Liz Clark. Please go ahead.
Good morning, everyone. I'm Liz Clark, and I work with the Professional Development Services branch. Thanks for joining us for the Secure Beef Supply Plan webinar. Today's speaker is Dr. Danelle Bickett-Weddle. Dr. Bickett-Weddle is a South Dakota native who earned her DVM from Iowa State University in 1999, her Master's of Public Health degree from the University of Iowa in 2003, obtained diploma status at the American College of Veterinary Preventive Medicine in 2006, and completed her PhD in 2009 from Iowa State. Danelle worked in private practice, followed by industry as a dairy nutritionist, then entered academia. In her role as the Associate Director of the Center for Food Security and Public Health at Iowa State University, she managed the development of materials for the USDA-APHIS National Veterinary Accreditation Program for 10 years. She currently leads the Secure Milk Supply Plan and co-leads the Secure Beef Supply Plan, which involves business continuity guidance in the event of a foot and mouth disease outbreak. Her passion is biosecurity. Her mission is to educate and inspire others about diseases and their prevention, empowering people to do the best job they can do to care for animals. And I'm going to turn it over to Dr. Bickett-Weddle.
Thanks very much, Liz. I'm excited to talk to you about the efforts being put forth for the beef industry in the event of a foreign animal disease outbreak like foot and mouth disease. The Secure Beef Supply Plan is the most recently funded of the Secure Food Supply Plans, with funding from USDA-APHIS beginning in 2014. Milk supply was funded in 2009. It was chosen because of the just-in-time nature of a perishable product like milk. Secure Pork Supply Plan was funded next, looking at movement of animals. The benefit that the Secure Beef Supply Plan has experienced with all of these is that we've learned a lot in those years, and Secure Beef Supply has actually started at a more advanced stage than either of those two other projects. It's also important to note Secure Beef, Pork, and Milk are all funded by USDA-APHIS, and some funding was also provided to the Secure Pork Supply Plan from the National Pork Board. A little review on foot and mouth disease virus. It's a highly contagious infectious virus of those cloven-hooved or two-toed animals, including cows, sheep, pigs, and goats. Another important thing to note is it's not a public health concern. Some people prefer to refer to this disease as hoof and mouth disease because it is an animal disease. When an animal becomes infected with the virus, it causes vesicles or blisters either in the feet, on the mouth, in the tongue, even on the teats of lactating cattle. And this results in production losses because those animals don't want to walk, because their feet are sore, they don't want to eat because their mouths are sore, and because they're not doing either of those, production goes down in both our cow-calf herds and our dairy herds. Been very fortunate that the last U.S. outbreak was in 1929. So why should we be concerned about foot and mouth disease? Well, looking globally, there's been 96 countries that are endemic and have never been free of foot and mouth disease. So the potential for an accidental or even an intentional introduction is very real. The United States has had 9 foot and mouth disease outbreaks, and all of those were controlled through stop movement protocols and stamping out or depopulating the infected herds. We're going to talk about what the approach is today if foot and mouth disease were to be diagnosed in the United States. The playbook that we would all rely on is the USDA's Foot and Mouth Disease Response Plan, also referred to as the Red Book. This lists the capabilities needed to respond in a foot and mouth disease outbreak, as well as the critical activities and the timing of those. It really focuses on those infected, contact, or suspect premises and how to handle them. And it describes the 5 different response options, from stamping out alone to stamping out combined with an emergency vaccination, either to kill those animals, send them to slaughter, or allow them to live, or a strategy that's just vaccinate to live. So for more details, I recommend you refer to the foot and mouth disease response plan. Within the foot and mouth disease response plan, it refers to the secure food supply plans for more information on herds that are not infected. So that is what our focus is today, is on those farms that are affected by movement controls. They're located within that control area, but they're not infected with the disease. So these two sets of materials, the FMD Red Book and the Secure Food Supply Plans, are the pillars in which our state and federal officials will help make the management decisions during an outbreak. The Secure Food Supply Plans have a set of goals that closely align with the Foot and Mouth Disease Response Plan goals. We're all interested in detecting, controlling, and containing foot and mouth disease as quickly as possible, avoiding interruptions in the movement of animals or animal products from those farms that don't have any evidence of infection, so that we can provide a continuous supply of safe and wholesome food for our consumers. And finally, to maintain business continuity for all aspects of the industry through response planning. You can find more information out about the Secure Food Supply Plans on the USDA APHIS website under Emergency Response, or the Center for Food Security and Public Health website under our Secure Food Supply tab. So I mentioned business continuity. The business continuity aspect in animal disease response planning is creating those protocols and procedures before an event that would allow ag and food industries to maintain some of their critical aspects of their business or return to a more normal state of business during that actual response. But this can only be done if the risks for those animals and animal products that spread disease can actually be managed. So when we look at business continuity planning, what we're trying to do is minimize those negative effects, those unintended consequences, control and eradicate the disease without actually destroying the industry that we all love. Another important part of this is to provide those risk-based solutions that are derived from scientific data, as well as our national plans and our international standards, so that we can continue to provide safe, high-quality food for our consumers. Within the FMD Response Plan are guidelines surrounding movement within control areas. So as we know, infected premises will have an infected and a buffer zone set up around it. There will be quarantines put forth in that area. Movement of animals or animal products will be by permit only, and those decisions will be based on the risk of that movement. And we're going to have those controls in place until that control area is released. So it's important to note that the Secure Food Supply Plans are focused on business continuity for farms that are affected by movement controls, but not infected by the disease that we're trying to control and eradicate. The question has come up, well, how long would those movement controls be in place? Domestic movements, we're going to depend on how quickly the disease itself comes under control. Exports or international movements may take a lot longer to restart. So this graphic is demonstrating some outbreaks that have happened in countries that were originally free of FMD but had an outbreak. So across the bottom you see Japan in 2000, United Kingdom in 2000, which lasted into 2001, France, another outbreak in the United Kingdom, and a Japanese outbreak where they utilized vaccination. The blue bars indicate how long was the actual outbreak from the time it was diagnosed until the last case was seen. The green bars indicate when did the U.S. recognize that country as free, and the red bars is when did the OIE, or the World Organization for Animal Health, recognize that country as free. And you see the discrepancy. The blue bars are the same height because the outbreak was always identical. But the U.S. was always a little more strict, or a lot more strict in some cases, of accepting products into the United States after these countries had an outbreak. So when we talk about movement controls, the export piece of this is a big unknown. It could be an extensive period of time before the U.S. would regain its exports. The Secure Food Supply Plans are focused on domestic movement because we still will have consumers in the U.S. That need these products. So we'll focus our efforts on getting guidelines in place to help with the domestic movement of product. So we'll turn our focus now to the Secure Beef Supply Plan. We have more information about the plan and the various resources we'll describe today available on the website securebeef.org. So the Secure Beef Supply Plan is a work in progress funded by USDA cattle health programs. The guidance developed to date is the result of an extensive set of discussions in partnership with the beef industry, universities, states, and USDA. Participation in it is voluntary. The first area that we worked on was moving finished weight feeder cattle with no evidence of FMD infection to packing. We're expanding now to include feeder cattle inputs. The Secure Beef Supply Plan has tools to help producers protect their herd from FMD exposure, and we'll talk about those today. The Secure Beef Supply Plan is also developing guidance for producers, transporters, processing plants, and those issuing movement permits during an outbreak. So I want you all to recognize it's not too late to be a part of the discussion because much more work remains. Just after the project funding was received, we formed a steering committee consisting of beef industry representatives that you see listed on the screen. We also included the National Cattlemen's Beef Association, the American Association of Bovine Practitioners, the Academy of Veterinary Consultants, as well as the North American Meat Institute. There are several federal officials, both from APHIS and FSIS, as well as state officials that have been involved in this discussion from the beginning. The project is managed by academic partners, including my colleagues here at Iowa State University and at Kansas State University. We had an initial meeting with the steering committee in January of 2015 to identify gaps, challenges, and to develop working groups to address those. We're planning another meeting in January of 2017 to review those accomplishments, identify additional gaps, and continue working on the challenges put forth. Out of the initial 2015 meeting, 6 working groups were created. Each have different objectives, and they're led by either an academic or an industry partner. Initial conference calls allowed us to generate ideas, and then the academic partners created documents for those working groups to review. As time progresses, the scope of the work for each of these has grown and been modified a bit. Some are more active than others, just depending on their task. The working group members volunteer their time, and we really appreciate them sharing their expertise to create the various guidance documents. We're going to talk about the outcomes of these various groups in today's presentation. It's important to recognize that everything that is developed for Secure Beef Supply is guidance only. Our responsible regulatory officials are going to need to make decisions based on the outbreak, its characteristics, and scope, which may be different than what we had originally planned for. Begin by talking about the efforts of our Managed Movement Working Group. They started by developing guidance for those that are tasked with making decisions regarding the movement of cattle and supplies during an FMD outbreak. The document they created is available on the Secure Beef Supply website. So at the beginning of an outbreak, the highest priority is to prevent disease spread and, if possible, stamp out FMD and reestablish the U.S. as an FMD-free country. Those stop movement controls are going to be put in place, and no new movements will be initiated from the FMD control area for a period of time. So thinking about the cattle industry, it's very, very mobile. We're shipping cattle between production phases and to packing plants all over the United States. Cattle that are already on the road need to go somewhere when an outbreak is declared. So the Managed Movement document describes what we call land the plains approach, similar to what happened on the September 11th terrorist attack. Not to make light of that tragic situation, but it allows people to understand what needs to happen for the health and welfare of cattle or any susceptible species that are on the road in livestock trucks. So on September 11th, all airplanes that had not taken off were immediately grounded. The pilots that were in flight were told to land their plane as quickly as safety allowed. No new flights were initiated until the extent of this situation was assessed. So eventually, new safety protocols were put into place to allow air travel to resume in an orderly way under a heightened and new degree of security. So instead of flights, our state and federal officials will need to manage truckloads of cattle similarly. No new movements, No new movements until those new heightened biosecurity measures and cattle surveillance pieces are put into place. So this depicts a timeline of early events that you will find in the Managed Movement document. So cattle movements can be divided into two chronological periods, separated by a period of non-movement. That gives us that time to establish those appropriate heightened security and movement permitting systems. So early in phase 1, the goal will be to halt cattle movements in an orderly way within the control area as we described, and figure out an acceptable destination for cattle that are coming from within the control areas. During the rest of phase 1, the extent of the outbreak needs to be assessed to guide the response. Once it's defined and movement permitting systems are established, the goal of phase 2 will be to restart movements and maintain that continuity of business for premises that have no evidence of FMD infection while reducing the spread of the virus. During the stop movement phase, which could extend beyond the control area out of an abundance of caution, contingency planning is essential. Cattle producers should plan to hunker down for at least 4 to 5 days. At this time, they should focus their efforts on enhancing their biosecurity to prevent their cattle from becoming exposed. Implementing plans for getting feed, employees, supplies, managing mortalities, and other business aspects should begin immediately. The Secure Beef Supply Plan provides tools to help the feedlots make those plans. And you'll see a picture here of an appendix that we have looking at inputs and outputs to the feedlot and helping to go through some contingency plan steps. How soon we will restart movement will depend on the type, which is a categorical measure of the outbreak's magnitude, and the acceptable risk within the various states. There are 6 potential types of an FMD response. Strategies for the management of an FMD outbreak are going to change as the outbreak progresses. And it's going to depend on the magnitude, the location, how big is it, right? Are we in a focal outbreak, large regional outbreak, or is it fairly widespread within the U.S.? And other characteristics such as how easily transmissible the virus is, and all of these are part of what we think about as we develop the various components of the Secure Beef Supply Plan. So keep these different types in mind as we progress in today's presentation. So another movement that is essential to the cattle industry is to and through a packing facility. Foot-and-mouth disease could be circulating in cattle prior to them showing clinical signs, or even testing positive by PCR. It's not possible to prove freedom from FMD infection in an animal or in a herd. And we're going to talk a little bit more about surveillance in a bit. So therefore, all beef from a processing facility that received cattle from the FMD control area in the days prior to the outbreak may potentially contain the FMD virus. Keep in mind that FMD is not a public health or food safety concern. It's an animal health issue, just like bovine viral diarrhea, or BVD, which is a virus that normally circulates in our cattle herds today. So the Secure Beef Supply Plan includes the following guidelines. Animals that pass antemortem and postmortem inspection by USDA's Food Safety Inspection Service are safe for human consumption, even if they may be in the preclinical stage or even recovery phase of an FMD infection. And their products should be able to enter normal human commerce. So given what we know about FMD virus, packing plants should continue to process all animals in the plant and in transit to the plant, especially those that cannot be turned back or euthanized while in transit, during the beginning of a foot-and-mouth disease outbreak, or phase 1. So again, these are guidelines you'll find in the Secure Beef Supply Plan. During phase 2, once we've characterized the outbreak, and with a type 3, which is, again, a large regional outbreak or even greater in size, the Secure Beef Supply Guidelines state that market-ready cattle from herds in the control area that have no evidence of infection should be sent to slaughter as quickly as possible. This could help us control the disease spread if susceptible species are removed from what we call the hot fire. So when animals recover and are capable of passing FSIS inspection, they too could be sent to slaughter. So again, guidelines from the Secure Beef Supply Plan. In order to accomplish this, our packers have to be in agreement to take those products. So we have a unified packer approach, working with both beef and pork packers and processors to increase awareness of the various aspects of FMD preparedness planning and sharing these recommendations I just covered for you today. Likewise, there's conversations happening between APHIS, who will manage a foot and mouth disease outbreak, and FSIS, who is charged with managing food safety in our plants every day. The Secure Beef Supply team held a webinar with the members of the North American Meat Institute to share information and to begin identifying their concerns. As with any food product, it's up to the consumer to purchase it. That will ultimately determine the packer's acceptance of the cattle. NAMI, North American Meat Institute, has formed a task force of their members to address the gaps and issues of concern so that we can better develop response and continuity business plans. And we're happy to be part of that discussion from the Secure Beef Supply standpoint. To move cattle from FMD control areas to either packing, as we just discussed, or getting even supplies into a feedlot, movement permits are going to be needed. So we're going to talk about that next. To request a movement permit, producers are going to need to provide a lot of information, which will be evaluated by regulatory officials. So some of the things they'll need to provide are, well, where are you moving? In this case, it would be out of a control area. For what reason? Direct to slaughter. So the premises of origin needs to have an identification number or a PIN. They also are going to want to know, how are you preventing potential spread? The destination also needs to have premises identification number, and we need to make sure that they're willing to take it. In this case, what are we moving? Live cattle, but it could be feed, such as dried distillers grains or manure. How long is this movement going to occur? Does it occur just once? Is it a daily movement in the case of feed? Is it weekly? So these are all pieces of information, data pieces that need to be managed. So throughout the Secure Beef Supply Plan, all of our guidance documents, the goal is to prevent the potential spread of foot and mouth disease virus. Producers are responsible for keeping their herd free of infection, just like they are every day, to prevent exposure. Responsible regulatory officials, our local, state, tribal, and federal officials, are responsible for protecting animal health during a foreign animal disease outbreak or prevent spread. So therefore, they're the ones that are going to determine the requirements to receive a movement permit when a feedlot finds itself within a control area. Permits were used extensively in the HPA outbreaks that occurred in 2014, 2015, and even into 2016. Here we compare what was needed for HPAI and foot and mouth disease. So for instance, both are going to need premises identification numbers, prem IDs or PINs, biosecurity around the truck and driver, and surveillance. FMD, however, poses some unique challenges for surveillance, which we're going to talk about today. And the overall permit requirements for FMD are still in discussion. So those movement permits are just one example of the large amount of data involved in emergency response management during an FMD outbreak. Other items include the actual FAD investigation records, all of those PINs or national premises identification numbers, laboratory results, how to allocate resources, and other things. So the PINs, the premises identification numbers, are available from state departments of agriculture or boards of animal health. States are encouraged to transfer any of that premises data into EMERS, the Emergency Management Response System, prior to an outbreak to help facilitate response. USDA APHIS utilizes EMERS as their official record-keeping system for all animal health events. So mentioned, in order to get a movement permit, biosecurity is going to be needed. So the Biosecurity Working Group aims to help producers protect their herd by describing biosecurity measures that can offer protection when effectively and consistently implemented by everyone. However, it's important to note that a routine level of biosecurity is not sufficient to protect cattle from a highly contagious disease like foot and mouth disease. The animals don't have any immunity to these diseases. These diseases cause animals to shed high amounts of virus, and those around them have very low levels of resistance. So we have to recognize that biosecurity to keep out a highly contagious disease is expensive, and it's very inconvenient for people to consistently implement, especially on animals raised outdoors like feedlot cattle. But it should also be noted that losses from foot and mouth disease infection will be very expensive to producers, the industry, and U.S. animal agriculture as a whole. And the disease itself is pretty awful for cattle. It's very inconvenient for them to have to deal with foot and mouth lesions. So recognizing this, the principles of biosecurity for all our secure food supply plans focus on providing tools to help producers keep their animals from becoming infected. There's three concepts that all feedlots should be ready to implement in the event of a foot and mouth disease outbreak in the United States. One is to have a written operation-specific enhanced biosecurity plan. Two is to have a biosecurity manager that can help develop and monitor how that plan is being implemented. And three is the concept of a line of separation. We're going to talk a little bit more about this, but the premise behind it is nothing should cross the line of separation that can introduce virus. Outdoor housed animals are more difficult to protect, but this concept can still help. Existing biosecurity plans for feedlots may offer some protection against endemic diseases, but heightened precautions are needed for FMD. We've created a self-assessment checklist for enhanced biosecurity at beef feedlots that looks at whole premises prevention strategies based on what we know and how we know FMD is spread. So this checklist and a corresponding information manual can be used to develop that operation-specific enhanced biosecurity plan I just mentioned. I should also point out that we're creating unified materials across dairy, swine, and beef operations so that for mixed operations that may have feeder cattle and pigs, they're going to have the same information and same requirements for that specific species. There may be little nuances, but the messages behind them are the same. These checklists were modeled after a poultry checklist that was created after the 2015 high-path avian influenza outbreak. That poultry checklist, since its original creation, has been revised and incorporated into the National Poultry Improvement Plan in August of 2016. The poultry checklist does include auditing, though. The Secure Beef Supply checklist leaves auditing decisions up to the states managing their outbreak. The information manual for enhanced biosecurity for feedlots corresponds to the checklist, and it's a guidance document for that biosecurity manager to develop the plan with the assistance of a veterinarian. The biosecurity manager serves as that point person on farm to oversee training and implementation of the plan, and I think this is one of the most important things, is they have the authority to ensure compliance. The information manual has multiple appendix logs for recording movements, determining where your line of separation should be, and so on. So they can be used by the feedlot and edited and customized for their operation. Once the checklist and manual are done being externally reviewed by our steering committee members and working group members, as well as the 50 state veterinarians, we'll make modifications to that, and it'll be found on our Secure Beef Supply website when it's completed. So back to the concept of line of separation. It's a clearly identified boundary around or within a premises that separates the susceptible animals from off-farm traffic, so that items that only cross have followed appropriate biosecurity measures. So the overall purpose of the line of separation is to limit movement of foot and mouth disease virus on the premises and exposing animals. So I think one of the things that we can do is visualize this LOS concept. If you picture the feedlot as a castle, and who doesn't like to manage their own castle, right? So picture that feedlot as a castle with walls, and you're trying to protect that operation. The line of separation then is the moat that is out in front of the castle around the walls, and the drawbridge is the access point, which is controlled by the feedlot. not controlled by the driver of that vehicle. So the feedlot decides when to lower the drawbridge and let in the feed truck or any other vehicle after it's followed appropriate biosecurity measures, such as being disinfected. So let's get back to reality. Here's an actual aerial view of a feedlot that has a livestock trailer there to load out cattle. So the line of separation should be a defendable boundary, and vehicles or people crossing it need to follow specific biosecurity protocols. So in this particular image, the livestock trailer can remain off the feedlot premises and outside of the LOS. The controlled access point is at the back of the trailer, and this would negate the truck from having to be cleaned coming on if the feedlot agrees to that. The cattle are the only thing that are going to cross over that LOS, and they're going in one direction, and that's off the feedlot. So in order to make this work, that feedlot's going to have to make sure that on-site vehicles, feed trucks, delivering feed to the pens are not driving in that area. Susceptible animals should not walk through this area unless they're going directly out to slaughter. Individuals that work on the feedlot should not walk through this area. And if they do, they can't cross the LOS. They can go off, but they would have to come back through a biosecure entry point. So let's look at what a biosecure entry point might be for people. The Danish entry system is utilized in the poultry industry quite commonly. And what it does is it provides a way to separate off-farm from on-farm, and therefore all of the clothing worn off-farm from on-farm clothing. So this particular picture has a dedicated entrance area. You could have a shed, a trailer, another covered area, something that straddles that line of separation. The line of separation access point is identified with a disinfectable barrier. You want to be able to clean that. And it definitely separates off-farm from on-farm. Both sides of the barrier have clothing and footwear storage and supplies and facilities for hand washing. You might look at this and say, wow, our feedlots don't normally do that. In a foot-and-mouth disease outbreak, things won't be normal for various reasons, and so thinking through how could we get our employees on such that they're not bringing things to our operation, nor are they leaving with things from our operation. So this is the line of separation concept for people. So to help educate our employees or visitors or livestock transporters and anybody else that needs to come onto the feedlot, there's a series of biosecurity posters available on the Secure Beef Supply website. They're designed to be printed on an 11 by 17 paper, so that you can see the pictures maximally and read the text, and they're available in English and Spanish. So if you're interested in those, we encourage you to download them from the site. We mentioned in order to get a movement permit besides biosecurity, surveillance is another component that is going to be needed for animal movement. So let's talk a little bit about what surveillance tools we have when it comes to finished weight feeder cattle. So the Foot and Mouth Disease Response Plan, that red book, in Appendix S, refers to the secure food supply plans for the surveillance methods needed for continuity of business purposes. So we're drafting documents for beef and dairy, and we're going to be sharing those soon for broader review. What they look at is what surveillance methods exist, what are some of the limitations, and what could we possibly do. We're asking our state veterinarians or state animal health officials, people from USDA Center for Epidemiology and Animal Health, our partners at FADL, the Foreign Animal Disease Diagnostic Lab, as well as our partners at NAL, the National Animal Health Laboratories Network. And working group members will also be reviewing this content. So when we look at surveillance to permit movement, they're going to need to demonstrate a lack of evidence of FMD. So one of those concepts is active observational surveillance. This is going to require people to be trained to monitor cattle for abnormalities. Feedlot personnel are used to doing that from a health standpoint already. We just have a couple other things that we want them to look for. If they find any abnormalities, they need to report those. And there will be periodic farm inspections or feedlot inspections by our responsible regulatory officials or their designees like an accredited veterinarian. It's important to recognize that the observational piece supplements lab testing. It's not a replacement for it. Right now, the diagnostic sample needed for cattle is an oral swab. And if you've ever worked around feedlot cattle, you recognize at finished weights, it's pretty difficult to get an oral swab from them because they're not used to being handled. Some don't fit in the snake that leads up to the chute to restrain them. And cattle of this size are at risk for carcass damage and injury, and the handlers are also at risk for injury. So what we're looking at are what other possibilities may exist. So oral fluid samples is used as a pen-level sampling scheme in the swine industry, and it's also used in cattle for bacterial surveillance. It hasn't been validated for use as a surveillance tool for FMD virus, but we started that conversation with our partners to see what would it take to research its use and how might we utilize it in an outbreak. So to address the need of looking for abnormalities in the herd, USDA funded the development of the Foot and Mouth Disease Pocket Guide for cattle. This resource follows cattle through initial exposure to day 18 when lesions are mostly resolved. It's available in English and Spanish in a booklet format or as a wall chart. We have free PDFs available also through the Secure Beef Supply website. So using those cattle guide images and other resources, training materials have been created for the Secure Beef Supply Plan. The focus is observing cattle for potential FMD signs with the goal of demonstrating a lack of evidence of infection. This active observational surveillance uses a multi-pronged approach to look at livestock, either cattle or pigs, for potential signs of early FMD infection in an outbreak. AOS can be done for cattle in all different production phases regardless of where they're housed. And those cattle health monitors are typically feedlot personnel that have a history of looking at cattle and are trained to find abnormalities that might indicate early signs of FMD. So at many feedlots, those cattle health monitors will likely be the pen riders and cattle managers. They need to be trained to look for those abnormalities. They need to record their observations daily. Even if they didn't see anything, that information needs to record daily. And then be prepared to share their observations with our responsible regulatory officials that may come and do an inspection. Another part of surveillance that is being proposed is veterinarians, accredited veterinarians, would participate in a herd inspection prior to loadout. They would look at the cattle ready to go, and they would also look at the records on that operation for the past 7 or 14 days, or whatever is determined to be the magic number by our incident command. It's important to note that this does not replace laboratory testing. It supplements it. And until we have good diagnostic tools available, this is one thing that's being heavily looked at as an option. Once foot and mouth disease is discovered in the United States, packing plants may be a point of identification of new cases since they serve as large commingling sites. Therefore, our group is also developing educational materials for packing plant workers, as they're going to have a very important role in surveillance efforts during an outbreak. So remember, FMD is not a food safety or a public health concern. It's an animal health issue. So I mentioned a lot of resources that we have available and more are in development, and you can find those on the Secure Beef Supply website at securebeef.org. Under training materials, you'll find many of the things I've already discussed, and more will be added. A concept that's introduced in the biosecurity documents relates to a pre-movement isolation period for feedlots that need to move live animals, given the challenges of laboratory diagnostics for preclinical animals. It's based on conversations that are happening within the poultry industry related to high-path avian influenza. So let's discuss how this will apply to cattle operations. So the pre-movement isolation period. Well, we recognize that biosecurity is very difficult in cattle housed outdoors. We lack good diagnostic tools that are going to provide at least 95% confident that a herd is FMD virus negative. And our goal is animal movement for business continuity purposes. So again, thinking about farms that have no evidence of infection visually through observational surveillance, if we were to move animals to a slaughter facility, they may be reluctant to accept them from a control area. Likewise, producers that have negative herds may be reluctant to receive animals from a control area. So if the source of cattle coming into the feed yard is in a control area, there may be some reluctance there. Likewise, our Unified Incident Command officials may be reluctant to let animals leave the premises and the control area. Again, everybody's got the responsibilities to decrease the spread of foot and mouth disease virus. So we look at this graphically, this pre-movement isolation period. We recognize that animals coming from a control area are higher at risk of being infected with FMD virus, but they may be undetected clinically, might not be showing signs. So the recommendation right now is restricting animal introduction onto the entire feedlot for a minimum of 7 days before any animals are moved to another production site. That can increase the confidence that FMD virus was not introduced through an animal movement, which is the highest risk of spreading FMD. This concept doesn't apply if animals are just being moved directly to slaughter, because that's a terminal movement and there's no animals to spread to at that next site. This concept is described in the figure you see on the slide. What we show here is a feedlot raising dairy heifers, which is more common than some people realize. So if a feedlot accepts cattle from a backgrounder that's within a control area on the first of the month, no shipments of replacement heifers that are also housed on that feedlot would go to the dairy until the following week, or on the 8th day at the very earliest. This minimum of 1 week restricted entry provides added assurance to those receiving animals that no clinical signs were found in the animals on the premises of origin. So if the feedlot doesn't wish to send any shipments of outgoing cattle other than direct to slaughter, there would be no restricted entry time between incoming loads of cattle. Cattle moving off the feedlot directly to slaughter can do so at any point in time once movement requirements have been met and a permit is issued. Again, a concept that we are talking about, and we're interested in feedback on that. So what do we do if the outbreak is too big, one of those category 3, 4, or sorry, type 3, 4, or 5 outbreaks to effectively stamp out? We recognize there's certain parts of the U.S. where the cattle density is so high that our resources, both human and financial, could be quickly depleted and overwhelmed to stamp it out. So our steering committee was very interested in planning for this possibility. Therefore, we created the Management of Infected Premises Working Group to address issues related to an FMD outbreak when it becomes too large to depopulate animals. This is going to present unprecedented challenges because there's no reports of managing large feedlots infected with FMD virus and allowing them to recover. Also, cattle in FMD endemic countries are typically vaccinated and don't experience the same signs. So this topic isn't unique to feedlots. Same things can happen with our dairies and our swine operations. So we're definitely working in concert on these concepts. So feedlot veterinarians and managers need to apply their experience and knowledge to help manage infectious disease. Specifically, things that are going to come along may be secondary bacterial infections due to foot and mouth disease virus. So the working group is drafting guidance documents to address the multitude of issues that are going to need to be managed. The infected premises are going to need to contain the virus and prevent it from spreading to other premises. Managing the health of cattle with lesions, using antimicrobials for those secondary bacterial infections, pain management, making sure we've got optimal rations for cattle that have sore mouths. Those are just some of the topics that are being looked at. Euthanasia is going to be needed for some cattle. It's important to note to people that indemnity is not paid in those cases. Those are considered humane euthanasias, not a take by the government, so no indemnity will be paid. Carcass disposal options are going to have to be site-specific. Working to regain FMD-free status for the United States is another topic. Could we market our recovered animals? What testing would be required prior to movement of those animals? Will the packers take them? So we ask a lot of questions, and we don't provide all the answers, but we're trying to provide as much guidance and resources as we can for people faced with those decisions. Communication. Communication is a big piece of this. So we are looking at how do we keep everybody on the same page with respect to the foot and mouth disease response plan. So today's opportunity to connect is a perfect example. We've written a series of articles about the Secure Beef Supply Plan for the Iowa Cattlemen's Magazine, National Cattlemen's Beef Association's Beef Issues Quarterly, you see pictured here. And we have those if others want to utilize them to inform audiences of what the secure beef supply is about. The Communications Working Group also works with packers, retailers, and consumers to understand that foot and mouth disease is not a public health or food safety concern. And we're very fortunate that our coordinator of this group works for NCBA and is heavily involved in the FMD cross-species communications group. They have put together a website, which you'll see if you go to footandmouthdiseaseinfo.org. It's a reputable place to find easy-to-understand information about foot and mouth disease. Sponsored by Beef and Pork, the American Sheep Institute, as well as Dairy Marketing. Even in the last 6 months, the Centers for Disease Control and Prevention has updated their website. Why do I bring up the CDC? Well, a lot of people commonly confuse foot and mouth disease with the disease of little humans called hand, foot, and mouth disease. So if you go to the CDC's website, you will find on there that they actually have a spot that says this is commonly confused, and they are not the same. So that clear messaging is needed before and during an outbreak to help consumers maintain confidence in our food supply. So that's kind of a wrap-up of all the working groups and a summary of the documents that we have created to date. A lot more work remains in our future. We're right now writing a summary plan for the secure beef supply, linking to various resources that are available through USDA and being developed through the secure beef supply plan. That permitting guidance piece to move live animals is in discussion. We mentioned some things that may need to be required. We're still talking through what the surveillance piece could look like and how to get biosecurity more uniformly implemented. We're also expanding the scope. We talked about moving finished weight cattle to packing, and now we're working on getting things into the feedlot from backgrounders and stockers, as well as the dairy beef sector. So I think it's important to wrap up with our secure beef supply website. If you have specific questions for us, you can always email us at sbsinfo@iastate.edu. And as I mentioned a few times in here, this is all in development, it's all guidance, and if you are wanting to get engaged, please reach out to us and we will definitely get you plugged into one or more of the working groups. Thank you for your time, and I look forward to answering any questions you may have.
Okay, we do have one written question. How may we join the working group?
Excellent. To join our working groups, I would recommend you send an email to the email you see on the screen there, sbsinfo@iastate.edu. If you have a specific interest area or expertise, let us know that, and we'll get you connected to the various working group coordinators.
Okay, so it doesn't look like we have any other questions. Oh, no, we have someone just raised their hand.
We do. We'll go to the line of Juliana. Please go ahead. Your line is unmuted.
Hi, Danelle. It's Julie Lennox from the USDA APHIS. And I was just wondering if you have any insight into how public perception would go as far as when you talk about the consumer perception and demand for the meat. Do you have any insight into what we would predict as far as a public response for that?
Julie, thanks for that question. Our communications group, the FMD cross-species communication team, has actually looked at that, and it varies. Consumers, we've learned putting out information prior to an outbreak to tell them all about this disease does not resonate well. Those that were asked, would you eat beef? Would you eat beef from vaccinated animals? It depended. Consumer acceptance was pretty variable. What we don't know is we just went through the largest animal health disease outbreak in our history with high-path avian influenza. And the data that looked at consumer consumption of poultry and poultry products, people were making decisions on eggs based on price, not on food safety. So we haven't had a consumer panel done since then, so I'm leery to say that consumers are wholeheartedly going to back away from it. If the price drops, which we expect it will because exports are going to be shut down, We're going to have excess capacity, which we know drops prices. It's our assumption that certain portions of the nation will continue to consume beef and beef products just like they did beforehand. And the messaging that people are developing around that through the cross-species communication team as well as USDA APHIS are focused on the health and safety of the meat products, that it's an animal health issue. So the stuff that was done is a little bit old. It did show some skepticism on parts of consumers, but maybe it's my optimism that looks at the differences after an HPAI outbreak. I think we might be in a better situation than we thought we were originally.
Okay, great. Thank you.
Thank you.
And there appear to be no further questions at this time.
Okay, if there's no further questions, I'd like to thank Danelle for her great webinar presentation. And I also want to let everyone know that we will have another webinar on the Secured Pork Supply Plan on December 13th at 11 o'clock Eastern Standard Time. And information will be sent out in the next couple of weeks. And I'd like to thank all of you that joined in today, and hope everyone has a great afternoon.